visit your grandmother and she doesn't recognize you. She stares at you for a while and still can't get it. How about watching her be fed when she used to feed you? These are some of the symptoms of Alzheimer's. No one wants this disease in their family because one day they could lose their family member. I could one day have Alzheimer's because my grandmother died with it. First, we're going to examine the history of the disease Alzheimer's. According to the website National Institute on Aging, last accessed February 24, 2016, Alzheimer's was first discovered by Dr. Alois Alzheimer in 1906. He had a patient suddenly die. She had an unusual mental illness. She had several behavior problems, memory loss, and even some language problems. He performed an autopsy on his patient, and he found large abnormal clumps on her brain, and even tangled fibers. These effects on the body can be detrimental and are sometimes irreversible. It destroys your memory and your thinking skills, which then causes dementia, the loss of cognitive function. It can affect your thinking and your remembering. Second, we're going to look at Alzheimer's Association webpage, which was last accessed on March 8, 2016, where it shows that Alzheimer's was first treated with a nutritional diet, physical activity, social engagement, mental stimulating pursuits. Factors can reduce the risk of the cognitive decline, which is Alzheimer's. There are clinical trials. In these tests, they have tried to do memory thinking skills, problem solving, and even attention getting, counting, reading, and writing. There also are standard blood tests that can be performed, along with brain scans, such as a CT scan and MRI. These need to be repeated as you age to show if there has been any change. There is unlikely any one drug that can treat Alzheimer's. So a current approach is to help maintain your mental function, manage behavioral symptoms, and even slow or delay the process of Alzheimer's. Research developed different theories and an underlying cause to try to stop and even prevent Alzheimer's. The Alzheimer's Association webpage goes on to say that Alzheimer's accounts for 60 to 80% of dementia cases. Most people are over the age of 65, with about 5% of these people having an early onset of Alzheimer's in their 40s or in their 50s. They're going to have common behavior problems such as agitation, sleeplessness, aggression, and anxiety. Treating these problems make it easier on the patient and their caregiver. So third, we're going to talk about new cutting-edge treatments. And according to the National Institute of Aging, their website says that they do clinical trials. They need 70,000 volunteers. They have over 150 different trials that they try to understand and diagnose and treat Alzheimer's. So the volunteers need to be of different ages, sex, race, and even ethnicity. So we need people to volunteer. You can also donate to the Alzheimer's Association that is tax deductible. It's a vital research that we need to support the interventions, immunization therapy, drug therapies, and cognitive thinking. So today we have looked at Alzheimer's disease. First, we examined the history of the disease. Second, the prognosis. And then before finally observing the future of this illness. I encourage you to be tested if you think you have the symptoms of Alzheimer's. Since my family was affected by this disease, I have become more aware of the signs. If you or your family is plagued by this disease, you now know a little bit more.